Cardiovascular disease is the leading cause of death in the United States, with one person dying every 34 seconds due to an underlying heart condition. To avoid becoming part of these statistics, you must take responsibility and preventive measures to avoid severe heart complications. But what are the symptoms of an underlying heart condition? Stick around till the end of today's video, because we'll cover the warning signs and symptoms that your heart may be in trouble. Hey viewers, I'm Dr. Sophia Fahl and welcome to the Lovers of Good Health channel. Before we begin, kindly use some time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. 1. First up, do you notice swelling in your lower limbs? You may have something called edema. This condition causes the appearance of puffy legs, ankles, and feet. Edema occurs because too much fluid is trapped inside your body's tissues. When you press your skin, it might produce a dimpling effect known as pitting. Edema is one of the initial signs of congestive heart failure due to sodium and water retention. Do you feel like you're dragging your legs as the end of the day approaches? One of the contributing factors to edema is gravity. As you go about your day, fluid accumulates in your lower body, and if you're standing for most of the day, the condition will become more severe. Those with edema should regularly raise their legs and keep them elevated when they get the chance, so that fluid can flow back to the rest of their body. Wearing compression garments and reducing your salt intake can also be of help. 2. Next up is excessive hair loss on your legs. Have you been losing your hair, not just on your head, but on your legs too? Studies have shown that hair loss on your legs, especially your shins and thighs, is a vital sign of peripheral artery disease, a condition where the arteries in your legs become blocked. Your blood is responsible for supplying nutrients and oxygen throughout your body, and when there is restricted blood flow to your legs, your hair follicles fall short of these vitals, affecting your hair growth. Peripheral artery disease is dangerous and requires immediate attention. If one of your arteries is partially blocked, then there is a fair chance other arteries could be blocked too. Blockages occur due to the buildup of plaque deposits in your blood vessels and can lead to heart attacks and stroke. 3. If there are soft, yellowish deposits on your upper eyelids, your heart might be in trouble. Those with cardiovascular issues often develop small, light-colored plaques or papules on the upper eyelids, which are lipid-rich deposits primarily made up of cholesterol. This condition is called xanthelasma. Around 50% of people with xanthelasma have unbalanced lipid profiles, meaning their HDL, LDL cholesterol, and triglycerides levels are on a roller coaster ride, which can be extremely harmful to your body. High LDL cholesterol and triglycerides can cause plaque buildup in your arteries, restricting the blood flow to your heart and hampering its ability to pump blood effectively, leading to cardiac issues. Xanthelasma is commonly in those with diabetes, low HDL, or good cholesterol levels, fatty diet, excess alcohol intake, and weight gain, all of which are significant risk factors for heart diseases. 4. Moving on, have you noticed a white or grey ring around the outer part of your cornea? This greyish outer ring is called arcus senilis and is a buildup of lipids, mainly cholesterol. The cornea is the outer layer of your eye, which is transparent and round. Beneath the cornea lies the iris, the colored part of your eye that controls the amount of light that enters your pupil. Arcus senilis can make it seem like your iris has two colors, but it is the cornea's discoloration due to high cholesterol. This common age-related condition is mostly harmless and doesn't necessarily require medical intervention. However, those below 50 with a grey ring around their cornea might experience dyslipidemia, a condition where they have high cholesterol, LDL, or bad cholesterol, and triglyceride levels. 5. Did you know a poor healing leg ulcer could indicate a developing heart issue? Leg ulcers are open sores on the skin, often caused by an injury. They are normal and can happen to anyone. However, there is cause for concern if the sore takes longer than expected to heal. In such circumstances, you are most susceptible to bacterial infection, which can lead to sepsis. Sepsis is your body's extreme response to an infection and is life-threatening. Poor blood circulation slows down the healing process, making your wounds chronic. Blockages of blood vessels can cause such alterations in blood flow due to the development of plaque in the inner lining of your arteries. This is known as atherosclerosis. This damage could also occur due to diabetes, because high blood sugar can damage your arteries and have the same effects as peripheral artery disease. So far, we have discussed the subtle signs that your heart may be in trouble. Now let's look at the immediate symptoms of an underlying cardiovascular condition that you should never ignore. 1. Shortness of breath or dyspnea. Does climbing a few stairs leave you gasping for air? Or does a brisk walk seem too much for you? If you struggle to catch your breath during everyday activities, and no amount of rest has been able to solve it, it's probably because of an imminent cardiac event such as a stroke or heart attack. 2. Chest pain is a hallmark symptom of a heart problem. Also known as angina, reduced blood causes unexplained discomfort in your chest in the form of a dull ache. Sometimes, it may manifest as sharp stabbing pain, and your chest may feel tightened, making it difficult for you to breathe. It seems tempting to dismiss it as a muscle strain, however, ignoring this symptom can prove fatal. 3. Pain in arms, neck, and shoulders. If chest pain gradually moves to the other parts of your body, especially the area surrounding your heart, like your arms, neck, shoulders, and back, this could signify an impending heart attack. You feel pain throughout your limbs because a nearby accessory nerve becomes irritated, causing discomfort. 4. Nausea is a common symptom of heart problems in females. However, males are not immune to it and can feel like vomiting in the case of a heart attack. Although this symptom often gets ignored in light of an upset stomach, it is crucial to watch the symptoms accompanying nausea. 5. Cold sweats. Normally, cold sweats are due to anxiety, pain, hormonal fluctuation, low blood sugar, or infections. However, if you feel sweaty and clammy, accompanied by shortness of breath and pain in your chest or upper body, this is a silent indication of a heart attack. 6. Have you been coughing incessantly? Is your phlegm white or pink? This could be due to accumulated fluid in the alveoli, tiny air sac in your lungs that carries and transports oxygen throughout your body. This coughing is known as cardiac asthma. Despite its name, it is not a form of asthma. Cardiac asthma is coughing or wheezing that occurs due to congestive heart failure, which can lead to buildup in the lungs and airways. 7. Constant fatigue is a significant symptom of a heart condition. When your heart cannot pump enough oxygen, it fails to fulfill the energy demands of your body. Due to this, you feel a sudden drop in your energy levels, and the chores which were earlier very easy for you to do seem more challenging to get through, and you feel worn out. 8. An irregular heartbeat or palpitations is a common symptom of a heart issue. Exercises, running, smoking, stress, or use of marijuana and alcohol are the usual causes behind a fluttering heart. However, if you're sitting at home and experiencing palpitations, this could signify heart failure. A rapid heartbeat is usually compensating for being unable to pump blood properly. 9. You feel dizzy. When your heart cannot pump effectively, your oxygen supply becomes severely disrupted, and your body parts might not receive an adequate oxygen supply. This will lead to your blood pressure dropping to dangerous levels, and a reduced blood supply to your brain may result in lightheadedness. If you notice these signs in yourself or a loved one, don't hesitate to act, or it could be too late. Seek timely medical assistance, and give yourself another chance at a healthy and vivacious life. Have you noticed any of these signs lately? Let us know in the comments below. Thanks for your time, and see you at the next one. Don't forget to subscribe and like the video for more content.